Prior authorization makes that process go last anywhere from 5 to 7, and the longest I saw recently was 10 days, where they're just sitting in a hospital bed, just waiting. And that hospital bed could be used for one of those sick patients in the emergency department.
We have a solution to this problem. It's called universal single-payer health care for all.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up.
I'm emergency medicine and internal medicine, so I work in the emergency department and on the hospital wards. And the reason that I think it's important to come out here is because I think that what this is what happened to Luigi brought to the forefront that our healthcare system is broken. We have a for-profit system that diverts funds away from patients and patient care and towards these billion-dollar companies that have huge profit margins. And what a single-payer system does is it diverts that funds back to us. It cuts off the administrative overhead, an expansion, traditional Medicare as it exists today, which is the closest that we have right now to socialized medical system or a single-payer system. There is no prior authorization. There is no delay of care. And I think that there shouldn't be a rule that you need to be 65 to get that benefit. I think that if you're in America and healthcare is a right, healthcare should be a human right, then you should have access to quality care in an expedited fashion that is not being delayed or dragged out because that's been found to be profitable. And so that's why we're here to support a single-payer system. And because of the New York Healthcare Act, which is a single-payer act for us in New York, we have the 11th largest GDP in the world. There's no reason that we can't pay for it here.
Something that really has stood out to me in the aftermath of this, I've seen so many videos from doctors talking about how much they hate United Health, all these companies, and how much time they spend dealing with the insurance companies rather than patients. Can you kind of talk about your experience?
Sure. So I guess I'll say two things. One is that I'm glad that EMTALA is a law, because in the emergency department, that is not a thing. There's no such thing as prior authorization, and as emergency physicians, we're actually quite proud of the fact that we'll take care of anyone, anywhere, 24/7, 365. But then if you look at, so ACEP is the American College of Emergency Physicians, they put out a letter not too long ago that was kind of railing the system as it exists because it was delaying, it was the cause of ED boarding, which is, I'm not sure if you're aware of what boarding is, but if you're admitted to the hospital, it's the time that you still spend in the emergency department before you move upstairs. And now it's 2 or 3 days. And it's because of prior authorization. That's something that happens with these private healthcare systems that does not happen with traditional Medicare. And essentially what happens upstairs is, say you come to the hospital, you get admitted, you need IV antibiotics or something, and then it's determined that you need to go to a rehab facility. Prior authorization makes that process go last anywhere from 5 to 7, and the longest I saw recently was 10 days, where they're just sitting in a hospital bed, just waiting. And that hospital bed could be used for one of those sick patients in the emergency department.
And to be clear, because it's so backwards, the doctor, aka the expert, has already decided you need the care, but you then have to get pre-authorization from a faceless bureaucrat who in most cases is not a doctor.
A lot of times what has happened is the facilities have accepted the patient. So if you're going to go to nursing home XYZ, they say yes. Now we're waiting. Usually when we're doing our case management meetings, it's we have some acceptances, we're just waiting on the auth.
But you're not even waiting for approval from a doctor or an expert. You're waiting for approval from a company.
Yes.
When the expert has already said patient A needs treatment B.
Correct. And a lot of times for us, the thing that's delaying the care is we're patient A is better, and they just need to go somewhere where they're going to get physical therapy a few times a week so they can go home. And they're not getting that in the hospital because the hospital is not set up to provide physical therapy in any sort of reliable or regimented way. So we have patients that decompensate after they're well and healthy in the hospital, getting suboptimal care, waiting to go to a rehab facility that we, the experts, have deemed they're safe to go to. And then all the while you're waiting, kind of getting suboptimal care on the inpatient floors, we have a large cohort of patients waiting 2 to 3 days in the emergency department who are sick enough to be in the hospital and they need that bed. And so you can kind of start to see how the continuum of care is being disrupted by this for-profit system because of prior authorization, which is something that they made up so that they can, kind of root out their waste, fraud, and abuse that they really haven't proven exists, and it's just hurting people.
I don't know if you saw, it kind of went viral a couple of weeks ago. There was a doctor in Texas, Elizabeth Potter. Yep. She was basically called out mid-surgery.
And I've never had this happen before, but during the second deep, I got a phone call into the operating room saying that United Healthcare wanted me to call them about one of the patients who was having surgery today, who was actually asleep having surgery. And, said I had to call right now. So I scrubbed out of my case and I called United Healthcare. And the gentleman said he needed some information about her, wanted to know her diagnosis and whether her inpatient stay should be justified. And I was like, do you understand that she's asleep right now? And she has breast cancer. And the gentleman said, actually, I don't. That's a different department that would know that information. And I was like, well, she does need to stay overnight tonight. And you have all the information with you because I got approval for this surgery. And I need to go back and be with my patient now.
But United had called her, basically like, we need to know why this patient needs to be inpatient overnight. And for her going public about that, they sent her a 7-page letter from a defamation, and basically threatening to, essentially bankrupt her. Yep. If she doesn't take the video down and apologize.
United sent me a letter, which I'm going to share in its entirety here, and they denied my patient's overnight stay. I'm going to let their words speak for themselves. What I have to say is that my words were true. And although it is a bit intimidating to have a company like United send a letter like this to me, I know where I stand. I'm a woman taking care of women who are affected by breast cancer. And I know that I do that with all of my heart and in a way that I can be proud of.
What were your thoughts on that? Because it seems like United, in response to all of this, instead of actually, looking at their processes, maybe changing anything, it's to go after the doctor. Yeah. They even complained to the Securities and Exchange Commission when a hedge fund guy, Bill Ackman, publicly said, short United Health, basically bet against them. It seems to me they're spending more time going after doctors who criticize them than actually looking inward.
Yes. I don't know what more you want me to say. I know about the doctor, I know about the story, and I think it's terrible. I think now you're seeing more doctors speak out, but I think that it didn't happen quite as much before because we're busy. Most of what we do is we take care of patients. But now, I think unfortunately is also now incumbent upon us that we have to we have to come out and stand out in probably, if I check my weather app, it's probably feels like 6.
Feels like 20.
Feels like 20.
Well, the wind gusts, it's like 29 degrees.
Yeah, I was going to say, and we have to go on Instagram. We have to use social media to tell the stories of these patients because sometimes it's, if you didn't, then it'd be incredulous, right, that these things are happening to patients, but we all have our own stories about how the system is failing people. And I think now maybe the social responsibility is maybe coming a little bit more to the forefront, and it's a little bit easier to tell the stories of these patients. But it definitely takes away from time with our families to try to improve our healthcare system, but it's also our broken healthcare system is one of the reasons that we're burning out. A lot of doctors are flaming out of the professions. It's because it sucks to go to work than to know that your patient is being hurt and you can do nothing about it.
And tell me, what kind of medicine do you practice and how long have you been a physician?
I practice general internal medicine, and I've been a physician for about 50 years.
50 years?
Yes.
Holy cow. So tell me, I was just talking to another doctor. For you, why was it so important to be out here in the cold, specifically over this?
Well, because the public response to it has pointed out some major problems with the U.S. healthcare system. And, we have a system now where the insurance companies are really not just entities that get people care. They block people from getting care. And, that's a real problem for the individual patient, but it also is a problem for the physician. Because what happens is that we end up having to spend an inordinate amount of administrative time writing prior approvals, and then challenging denials of care. And that just seems to us to be totally useless.
And a lot of doctors are leaving the profession because of that. We're hearing more and more stories of doctors, nurses leaving because they're tired of dealing more with insurance companies than patients.
Yeah, there is that dimension, correct. So we have a solution to this problem. It's called universal single-payer health care for all. An improved Medicare for all, for instance, which would in fact eliminate the private health insurance industry, make them do some meaningful work rather than blocking people from getting care.
And also, something that stands out to me, the amount of money that Americans, who most people work paycheck to paycheck, have to pay for co-pays, deductibles, co-insurance, all of these extra costs. If you had a universal system, that money could be spent towards exercise, eating healthier. So you could actually improve the healthcare system if people had more money in their pockets than going to United Healthcare.
Yeah, well, and I think we have shown that, in fact, if we converted to a national single-payer program, there would be a major saving of money. And yes, that savings would hopefully get to patients so they could do the things that you just described: exercise, better food, so on.
Let me ask you, you've been in this for 50 years. What role does the government play here? Because 50 years ago, when you got into medicine, there wasn't as much, corporate money in politics, corporations, lobbyists. It existed, but it's gotten a lot worse in 50 years. Both parties take money from healthcare companies, pharmaceutical companies, lobbyists. What role are the politicians playing here? Because the Democrats years ago said, you had a candidate for universal health care, and their response was, people love their private plans. People want choices.
Well, what I have seen, frankly, is the fact that there has been an expansion of government-sponsored health insurance, right? Medicare made a big difference for people who are over 65. Just no question about it. Medicaid has done the same, albeit not as universally, for poor people.
Let me ask you a broader question. I don't really care about your politics, but Trump right now and his co-president Musk are literally taking a chainsaw, we saw, to different agencies. They're laying off healthcare workers. But the Democrats, they have talked about how people love their private health insurance. We can't change that. The Democrats take money from a lot of these companies. The mainstream media who's here, they take commercial ads from United, Pfizer. So it seems both parties are just kind of in on this scheme. And then when people call for reform, they say, but people want choices. I don't know. I've been going around the country for almost 10 years. I don't know many people that desperately want. I don't know if you saw years ago, Bernie Sanders did a town hall on Fox News of all places, and the anchor asked the Fox News audience, would you be open with a government system? Everyone raised their hand. I don't feel like a lot of people are dying to keep this private insurance industry.
So this is my opinion, and that's that. I know the statistics. I think it's like 80% of people say they're happy with their current insurance. But I would also venture to say that most people aren't using their insurance in a way that is disappointing them. And I think that you have to be sick to be disappointed by your insurance system. It's like my car insurance, right? Like, until I get into an accident, I'm not going to reflect on whether or not I like my car insurance. Yeah. Until you're admitted to a hospital and you realize what you're getting for the value, I don't think you realize, like, what it's doing to you. You may like the fringe benefit. It's like, oh yeah, they paid for my glasses. Like, I love my healthcare. But if you're admitted to the hospital and you're realizing that, you're sitting around waiting for prior authorization, or you're getting things denied, or God forbid you develop a cancer or an autoimmune disease where it's a little bit more difficult than you're just following up for your diabetes or your high blood pressure. I think that's when people are getting disappointed. Unfortunately, sick people are the minority of the population, right? Most people are well and healthy and are not reflecting and how terrible their healthcare insurance is. I personally like my healthcare insurance because I get my care at the VA. So I have very much enjoyed my socialized healthcare that I've gotten from my military service.
Well, let's hope the VA is still standing in a week.
Oh, that's also true.
Can I ask you, have you dealt with patients who you've had to talk to them and they're stressed out because they don't know if their treatment's going to be covered, or they've expressed to you, well, I might not follow up because it's not going to be covered? Because it seems like for a doctor, that's got to be tough. You want to help the patient, but a lot of them are stressed out beyond their illness with, can I pay for this? Will it be covered?
I think one of the beautiful things about living in New York City is that we have the New York City public hospital system, and I currently work at New York City Health and Hospital Facility. And I can say for certain that most of the patients, if you go to a public hospital system, it's like the Toyota Camry. It's not a Lexus of healthcare, but it'll get you there. We can provide documented or undocumented. We'll provide you with care, and it's going to be affordable. And so I think what's been nice is that most of the patients at county hospitals are Medicaid. And so most of them do get the care that they need, and there isn't that delay. But just to tell a brief story, recently I did have a patient on the floor who was actually quite concerned about their ability to pay, mostly because their healthcare insurer of their Medicare Advantage plan had called them and told them that they were going to have to pay more money for their room because they were in a single room. Now, this patient was admitted with pneumonia that was caused by their flu. So they were in an isolation room. They were not in a VIP suite. They weren't in any sort of special isolation room. They were isolated because we told them they had to be isolated so the rest of the people on the ward wouldn't get the flu. And one of the things that they had come in with was something concerning for our underlying heart disease. And so one of the things they were waiting for was a stress test to determine if there were any blockages in their heart. And they hadn't told me about the call, but they had tried to sign out against my medical advice. And I sat down and I talked to them for a while about how important it was for their health to stay and get this test. The test ended up being positive, and they ended up having 80% blockages in 2 of the major blood vessels of their heart. And when I went to go explain it to them...
That's a serious thing, 80% blockages.
It certainly is. And when to go explain to them their results and why we had to send them on for further testing and care, they actually apologized. And I was like, I don't know why you're saying you're sorry. I'm sorry that you're sick. But they said, well, I'm sorry I tried to sign out, but it's because my health insurer had called me and said that it was going to be more expensive because of the single room. And they were Medicare Advantage and Medicaid. And they were like, I don't know how I was going to pay for it. And I had never been angrier than this 69-year-old who was scared to stay in the hospital because of the cost, because her insurer tried to scare her out of the hospital. And I think that was probably one of the more emotionally damaging things that I've experienced so far, was this person who could, without that test, could be walking around as kind of like a ticking time bomb for a heart attack. 80% is almost 100%, right? Yeah, that really sucked. And that was something that was manufactured by our for-profit healthcare system.
My last question. I don't know if you noticed, but the media coverage of this has mostly been focused on Luigi Mangione. Most people I know aren't cheering for murder, but they at least support his right to a fair trial, aren't exactly losing sleep over a healthcare CEO being gunned down. But I'd like to ask you, because I've even, being out here, I've even heard some of the mainstream reporters asking, it's mostly focused on Mangione, do you support what he did, this and that, not exactly focused on the for-profit predatory system.
Yes.
Do you think the media coverage is focusing on the right things in this case?
I think that they're focusing on the things that people want to turn the TV on and look at, which is a lot of the rhetoric surrounding Luigi. And I think that a lot of what they have been talking about has not been how destructive our for-profit healthcare system is. So I agree with you. I think the conversation should be about how are we going to fix the thing that caused the murder, right? This murder didn't come out of thin air. We've been talking about how we've had a broken healthcare system for quite a while now. And now, hopefully, more people are going to talk about it.
And maybe talk about the fact that more people are dying from the system,
yes,
rather than allegedly what he did. So
yes. It's not like we don't have an option. It's not like we don't have an answer. It's not like we're throwing our hands up in the air and saying, oh man, our system sucks. Like, what are we going to do about it? We have a solution. It's a single payer system, similar to what other places have done. You know, we just the solution is there. We just have to embrace it.